officer in the health protection team as part of Birmingham City Council's public health division. I've been in this role now for coming up to a year, and I joined the team just as it was expanding. So there was 4 new members of staff, including myself, all hired at the same time to support the manager and the expanding sort of portfolio of work within our team. So yeah, my role has kind of been developing over the last 12 months in terms of taking on new things. But the kind of stuff I work on is, so I'll be involved in some of the response to non-COVID health protection incidents. That's often involving infectious diseases or environmental hazards. I'm also helping out with developing some new kind of systems and protocols to help facilitate the multidisciplinary response to those incidents as well. I'm also involved in tobacco control, air quality, and response to extreme weather incidents. So yeah, it's been a really interesting, challenging, engaging 12 months, like I say, with an expanding portfolio of work that covers a lot of different stuff now, and also get to help out with some other things in the team as and when needed. So yeah, interesting. So in terms of my journey in public health, it makes me feel older than I'd like to feel, but I guess it's been a fairly long one already, because I've kind of been involved in public health for the best part of a decade now, either in a professional or sort of academic or research capacity. But in terms of my journey in public health at Birmingham City Council, I took on a graduate role in national policy off the back of a fairly long period in academia, having done a master's and a PhD. So I kind of saw the graduate opportunity as, first of all, it was kind of perfect timing because it was just as I was finishing my studies. And I just saw it as this really great opportunity to see whether my skill set would be suited towards more of a practitioner public health role, and also whether local authority public health was something that I was going to enjoy, be any good at, and could see myself in perhaps in the medium to longer term. So yeah, I kind of jumped straight in and started in March 2020, just as we were going into lockdown as part of the COVID-19 pandemic. So my journey from that point till now has been exciting, engaging, challenging, full on. But if I had to sum it up in one word, it would probably just be varied, because I've just done so many different things that I just would never have expected that I would have done. In the couple of years that I've been here. So as a graduate, I think I was in that role for about 8 months, and I was placed within the COVID comm cell. So I got to do a lot of stuff around community communications and engagement, a lot of social media, a lot of sort of wider stakeholder engagement through things like neighbourhood network schemes, meetings, and that type of stuff, helping out with the division's kind of communications and engagement plan. And yeah, I also got to do some policy related projects and reports, and just all sorts of things really, and helping with kind of council member briefings and that type of stuff. And then after 8 months, an opportunity to take on a substantive role as an officer in the communities team came up. So I was fortunate enough to get that, and what that enabled me to do was to take a step up, I suppose, from that graduate level of work to taking on a little bit more responsibility. And it also allowed me to continue a lot of the things that I'd started as a graduate. So I'd kind of helped with setting up the COVID-19 Communities Champions, and initially they were kind of then being managed by the communities team. So I got to continue that and develop that and take a little bit more ownership of that type of project. And I also helped to set up things like the community health profiles, which is something that's continuing to be done by the communities team. So yeah, like I said, it just enabled me to take on a bit more responsibility, to continue to develop my working relationships and networks, both within the division, the wider council, and sort of wider stakeholders outside of the council, and to continue to develop my knowledge and skill set. And then an opportunity, a senior role opportunity came up within the health protection team. And it's honestly something I don't think I ever would have considered taking had I not have had the opportunity that I had as a graduate to have a go in the health protection response cell as part of the COVID-19 response. So sort of every few weeks, both as a graduate but also whilst I was in the communities team as an officer. I was kind of seconded across to help with the COVID-19 response. So whether that was kind of more administrative, of logging things, of making sure that records of workplaces or education settings were kept up to date, so we knew what was going on and what sort of support was being provided to those settings. I also got to try my hand at making some response calls, so kind of speaking directly to citizens in different settings to make sure they had adequate support, that they had the correct measures in place, that they were up to date with the latest guidance and that type of stuff. And that was something that I really enjoyed, was very engaged in, and it was something that really made me tick in terms of wanting to help develop the kind of systems and processes, and think about what are the right questions to ask and what are the right things to look for when you're kind of responding to quite dynamic incidents and trying to join dots together to figure things out. So I think it was that experience and all the other things that I kind of was able to build a foundation of in terms of council-based public health practitioner work that gave me the confidence to apply for a senior role within the health protection team, and I think ultimately helped me to get the job as well. So yeah, I think that summarises my journey. And just to summarise how the graduate schemes kind of helped me to look back on my experience with the council, I think really now, with enough time, distance and kind of ability to properly reflect on that period as a graduate, it's enabled me to see what a fantastic foundation of knowledge, experience, but also confidence that it gave me to then take on the subsequent roles that I have taken on, and ultimately, currently be in a job that I really love and I'm incredibly interested by and engaged in, and set me up for what I see as has the future to be a really fulfilling and wonderful career in public health. So yeah, I think it's that really. It's I wouldn't underestimate how taking on this kind of role can enable you to just grow and flourish in so many different areas, because it really can. And I think the really wonderful thing about the graduate role is that from what I saw of my own case, but also from fellow graduates in my cohort, was that nobody was really stuck to just kind of one thing. Everybody got to try their hand at lots of different things, and there was always that opportunity to do really self-directed and kind of self-managed work, but also to have that supervision and support and management as and when required. So I think that's it. Ultimately, it just creates this really great foundation, which can develop a bit of a launch pad for yourself to kind of get to where you want to be next to help develop your career.